It's Monday, December 2nd, and this is the Daily Medical News, where we bring you the top headlines in clinical medicine, plus an in-depth look at the day's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, adding an MRI screening after a negative mammogram could benefit women with dense breast tissue.
Late-onset multiple sclerosis is often more severe than earlier-onset MS.
Dapagliflozin delivers its heart failure benefits regardless of age or disease severity.
And obesity is dropping in young children in the WIC program.
Plus, how to manage pediatric patients' fear during minor procedures. But first, thanks to all of you who have helped make this podcast better by completing our short listener survey. If you haven't yet and you'd like to share your opinions, you can find the survey following the link in the show notes. And now, the news.
Among women with dense breasts, following a negative mammogram with MRI screening, half the risk of interval cancers. Those findings appear in the New England Journal of Medicine. Women with extremely dense breast tissue are at greater risk of breast cancer, and mammography is less likely to detect their cancers. While U.S. law directs breast density reporting, American guidelines don't recommend supplemental screening. Researchers at Utrecht University in the Netherlands explored the benefit of supplemental imaging among more than 40,000 women with extremely dense breast tissue and negative results on screening mammography. Those women were invited to undergo supplemental MRI or to receive mammography screening only. After 2 years, the interval cancer rate was 2.5 per 1,000 screenings among the women in the MRI invitation group. The rate among women in the mammography-only group was twice that, at 5 per 1,000. What's not clear is whether supplemental screening will lead to better overall survival. Dr. Dan Longo is deputy editor of the New England Journal of Medicine and professor of medicine at Harvard Medical School in Boston. In an editorial accompanying the study, Dr. Longo cautioned that it's unclear whether the tumors detected by MRI would never otherwise have been detected or threaten the patient's survival.
Multiple sclerosis symptoms starting at age 50 or after is more severe than earlier onset disease, and disability accrues faster when the disease begins later. It's not certain if the pathophysiology is different or if the disease is simply compounded by the effects of aging. But researchers at the University of Virginia say it's likely that patients with late onset are at greater risk of misdiagnosis and delayed treatment. In a study presented at the annual Neurological Association meeting, the investigators compared the charts of more than 1,300 patients with earlier onset MS with those of 143 patients with late onset disease. There was a higher proportion of men in the late onset group, 38% versus 26%. About 75% of patients with early onset had relapsing remitting disease and 10% had primary progressive disease. But the late onset group was about evenly split between relapsing remitting and primary progressive MS. Patients with late onset MS also had a higher degree of disability at their most recent visit across all subtypes, despite having a shorter duration of disease.
Neither age nor baseline health status affected the substantial benefits Dapagliflozin delivered for patients with heart failure with reduced ejection fraction. The DAPA-HF trial showed the diabetes drug was safe and effective at improving outcomes in heart failure patients, regardless of whether they also had type 2 diabetes. Researchers presented 2 post-hoc analyses at the AHA scientific sessions. In the first, University of Glasgow investigators found that even the most elderly enrolled patients, those 75 years and older, had a similar cut in mortality and acute heart failure exacerbations compared with younger patients. In an analysis by researchers at the University of Missouri, Kansas City, patients with severe heart failure symptoms at baseline received about as much benefit from Dapagliflozin as did patients with mild baseline symptoms. We'll be back after this message with more medical news.
Welcome back to the Daily Medical News. I am Nick Andrews. A federal supplemental food program continues to reduce obesity prevalence among children between 2 and 4 years old. The Special Supplementation Nutrition Program for Women, Infants, and Children program, or WIC, extends nutritional assistance to families whose income is 185% or less of the federal poverty guideline. From 2010 to 2016, the prevalence of obesity among children in WIC dropped significantly in 73% of 56 states and territories. The obesity prevalence declines varied. Puerto Rico experienced the greatest benefit, with an 8% drop in obesity. The decrease exceeded 3% in Guam, New Jersey, New Mexico, Northern Mariana Islands, Utah, and Virginia. These data appear in the Morbidity and Mortality Weekly Report.
Managing painful or fear-provoking procedures in children is a balance of preparation, intuition, and technical skills. That's the advice of Dr. Barak Kraus, a pediatric emergency physician at Boston Children's Hospital. Speaking at the annual meeting of the American Academy of Pediatrics, Dr. Kraus shared tips for producing a positive experience when children present for minor procedures, such as an intravenous catheter insertion or a laceration repair. Tip number 1, control the environment. Set the stage for a positive experience by decreasing sensory stimuli, minimize noise and bustle, as well as the number of people in the room, and minimize the reminder cues. Make sure to keep out of view medical equipment, a syringe, or anything that would trigger a child to be more concerned and anxious. If possible, do your prep work outside of a child's visual field. Dr. Kraus also recommends limiting the number of clinicians who speak to a child during the procedure. One person should do the talking to keep from confusing and distracting a child. Tip number 2, use age-appropriate language. Dr. Kraus uses what he calls parentese, a simplified way that parents use to talk to young children. It's clearer, simpler, more attention-maintaining, and has longer pauses. And he says that can be very comforting to children. For more of Dr. Kraus's procedural tips, click the link in the podcast notes. And that's it for today's Daily Medical News. Remember, you can find the Daily Medical News on Apple Podcasts, Google Podcasts, Spotify, Pandora, Stitcher, and TuneIn. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.